pink eye, how we treat it, and probably most importantly, things to actually prevent it, because we really want to prevent it. We don't want to have to treat it. So this is a calf's eye. It was a calf from the herd up here. Every summer for the last 4 to 5 summers, I've been doing vaccine studies looking at different protein vaccines, trying to develop a better vaccine for pink eye than what's actually currently available to you on the market. And this happened to be a calf from last summer. So my question to you is anything wrong with this calf's eye? Does it look okay? How many of you say it looks okay? Just raise your hand if it... Okay. Well, it actually, it does look okay, and on quick assessment, I would say it looks okay. It does actually have a little tiny spot right here, though. That's the reflection of the camera when we took the picture. But this little spot with a little bit of haziness around it is the star of pink eye. And it's very easy to miss this, and most of the time you are going to miss it. I'm going to certainly miss it. If I look quickly, I'm not going to see that. You've also seen these sorts of cases where there's you look in the eye, there's a foxtail in the eye, and so you then have to pull the foxtail out. One trick that will help to get those foxtails out is to take your thumb and put it on the upper eyelid and push the eyeball backward. And when you do that, that third eyelid is going to pop out. And that'll help you to be able to pull some of those foxtails out. This is the same eye over once a week for 3 weeks following the day we pulled it out. And you could actually see a fairly typical thing. The following week there was an ulcer in the eye. So we stain the eye by putting this green dye on the cornea, and it'll tell us when there's an ulcer. Well, there's an ulcer here, and then about a week later it looked like it was still kind of angry, but it was turning white. And then this is about 3 weeks later, and it's started to scar down, and it's going to probably be okay. One of the things we found in the calves at the field station over these years where we've been doing these studies is calves that are vaccinated seem to do better following having a foxtail in their eye. Those that have the foxtail, after you pull the foxtail, the ones that are vaccinated tend to heal right up the following week, and then those that are not vaccinated tend to get a more serious ulcer. Another calf. This was from the summer of 2000. This was calf number 228, right eye, on June the 6th. And you can see this spot right here. This was the beginning of pink eye. A week later, it really had not changed a whole lot. It did get a little bigger. The stain was more intensely green. But it was quite surprising to see just in 7 days, this eye just had blown up completely. And I'm sure most of you, and certainly I'd be in the same camp, I probably would be missing this unless I was looking carefully. At this point, you'd be seeing a calf that's got a lot of tearing on the eye. If you looked at it carefully, it would be starting to squint, hold its eyes shut. And then certainly at this point, it's going to have a lot of that flies and wet matting around the eye, pus coming out. So the question now is do you think this eye is going to heal? No. Some say no, some say yes. Well, when I saw this eye, I was pretty sure that a week later, when I was back again to see that eye, I was pretty sure it would not have healed. It would have probably popped. In fact, what it did, and it was quite dramatic, is a week later, that nasty, angry spot had started to form a scar. And you can see already here the red around that is blood vessels trying to fill in that spot. And when you see those blood vessels, that's when you know it's starting to heal. So that was a week later, and then a week after that, and then on July 25th, it looked like it was amazing. It looked like the eye had completely healed, and the calf could see quite fine.
Was that after you
This calf was a vaccinated calf. We also treated the calf at this point, and the drug we were using at that time was Nuflor. Okay, this is another calf I want to show you. This was from the summer of 2006. This calf was kind of a sad case. Every week I would come up to go through about 100 calves and determine do they have pink eye or not, and if they did, take pictures of their eyes so we could document whether they got pink eye. It's always disappointing when Dan and Dustin and everybody up here who works up here does a great job gathering the calves, so I just have to come up here and I go through them and then I go home. Well, this particular day we were short a calf, and so they went out on horseback looking for this one calf, and he had pretty bad pink eye in both calves, and he was stuck in some brambles, and they were able to get him and pull him out of the brush. But this was his left eye, and this was his right eye, so he was in a world of hurt. But the question I have for you is, which of these eyes are you pretty sure is going to go blind? I hear some say left, some say right. They both look pretty bad. I would have guessed they probably both had a good chance of rupturing. But right on this particular day, the right eye had already perforated, so it had already popped. And what you can see is this black tissue that's coming out through the center of the cornea. And what that is it's the iris. So it's once you start to see that, you know the eye's already ruptured, so that's a bad sign. These are some more cases of eyes that have already perforated. This was another calf, so you saw this sort of bump in the center of the ulcer, and then a week later it really had become more obvious that that eye had popped out or had ruptured. The calf was still able to form a scar over the eye, but eventually when it healed, the eye was not visual, so the calf was going to be blind in that eye. But you can see this, basically it's a white scar, kind of a fibrous thing on the surface of the eye. And I think some of you have probably seen these. These would be kind of the more classic pop eye, which not many of them, at least in the calves I've seen up here, will go on to do this, but this is another outcome, and certainly this eye is going to be is a blind eye. So we're going to talk about treatment, but as I said before, our goal should be prevention, so we don't even have to treat, but the preventives don't always work, as you know, and so we do have some options for treatment. And this lists probably the four of the more common ones. The one I don't have listed is penicillin treatment, so penicillin on the eye. I'll talk a little bit about that in just a sec, but one of them, the ones that's been around the longest, is LA200. That's actually labeled for treatment of pink eye in cattle. Another one is Nuflor. We did the study determining whether Nuflor was effective. The company that makes Nuflor came to us and was interested in testing it against pink eye, so we did a study up here at the field station, and it does turn out to be effective both at 2 doses, 3 cc's per 100 pounds in the muscle 48 hours apart, or just one single injection at 6 cc's per 100 pounds under the skin. Another drug that we tested up here at the field station was Asst. That's the drug that when it first came out, it had to be given right on the ear, right on the cartilage, like under the skin, between the cartilage and the skin. That drug is effective for pink eye. Now it's a little bit easier to administer because the company has proven that you don't actually have to give it on the ear itself. If you give it right under the skin at the base of the ear, that is, it's effective. That part of the carcass is not taken, and so the concern about drug residues is diminished. And then the most recent one is Draxxin, and that is also effective at a single dose. Draxxin was officially approved for use for treatment of pinkeye. At the time that the proceedings were written for your handout, that was not the case, but now Draxxin is officially approved for treatment of pinkeye. And so on this list, the only two technically approved drugs for treatment of pinkeye are Draxxin and LA200 or Biomycin 200. Other options, certainly the eye patches are pretty popular. There's sort of two schools of thought about eye patches. They're good or bad. I'm not a very dogmatic person. I think there's probably advantages and disadvantages. I think one of the problems, just die.
He's still on. Yeah.
Okay.
You want to switch into that?
Is that working?
No. That must
No.
be the mic. Let me get you the It's not this at all.
So I said the eye patches have, I think, advantages and disadvantages. One of the points when you put them on, try not to seal them completely all the way around. Try to leave an opening at the bottom so that you can get some air in there, so it doesn't become completely all moist and humid. The other thing is, don't just put the patch on and then never look at the cap again, because a lot can go to hell in a handbasket under that patch. So it's important to look under them periodically and don't assume that just because you can't see it, it's okay. The penicillin injections on the eye or around the eye in the eyelid are, I think they're difficult to do well. It takes a trained hand to get the penicillin in, and I've never been too comfortable about holding needles around cows' eyes or any animal's eyes. So just be. Is that better? Yeah. Okay. So as far as penicillin goes, just and giving the drug around the eye, just be careful. You don't obviously want to stick the needle into the eye. And so our goal really, as I keep saying, should be prevention. And how do we do this? One way would be weed control. So try to cut down on calves that are being exposed to foxtails. Don't spread infections between animals. One of those, all that liquid around the eye has got billions and billions of bacteria that we know can cause pink eye. And so you want to be careful. If possible, wear gloves when you're working around a calf like that, and then throw the gloves away or disinfect your hands somehow between animals. A number of different types of methods for fly control. These are summarized. Dr. Moss provided a summary of these different methods that is in the proceedings. But there are ear tags. Important thing about ear tags, take them off in the fall as the drug level diminishes. You don't want to have them around just because the possibility of promoting resistance would be increased. Sprays, pour-ons, back face rubbers, dust bags, and then there are some feed-through insecticides. But you do have a number of different options. Now, the vaccination approach is also important, I feel. This table shows 15 different products. I think this is actually all perhaps but one of the products that's currently available for treatment of pinkeye. Some of the products will provide coverage not just for pinkeye but for clostridial diseases as well, so you do have different options. One of the interesting things that you will notice if you look at this, the products that are listed with the green, there's 1, 2, 3, 4, 5, 6, 7, 8, 9 of those. There's one that's listed in the blue, and then these others that are all listed in the pink. These are all different products made by or marketed by different manufacturers, but if you actually look at the color corresponds to who made the antigen that's in the vaccine. All of the ones that are in the green were made by a company in Missouri called Addison Labs. All the ones in the pink are made by Shearing Plow. What vaccine companies do is they make antigens and they sell them to other companies, and they put their own spin on it. They will add their own adjuvants to help stimulate the immune system, but then they ultimately will market it under their own name. And so that's don't necessarily think that if there's two different products on the shelf, they're two protecting against two completely different strains of Moraxella. The other point I want to make is pay attention to whether or not there is a need for 1 or 2 doses. Some of the vaccines now will claim that they protect after you don't have to booster them, just 1 shot, and that will provide the protection. Try to vaccinate about 6 to 8 weeks before you would expect to start having problems. If you wait till you have problems, you've waited too long. And also, we always think about drug residues with respect to antibiotics, but there are also withdrawal periods associated with vaccines themselves. And the withdrawal time for those 15 different products that I listed range anywhere from 21 to 60 days. And that's related to what other components are in the vaccine and what other antibiotics are in the vaccine to help preserve the vaccine. And always follow what the manufacturer recommends. Some of the recent discoveries that we have made in understanding pinkeye and why it happens and how it happens is that we learned in 2002 that when we cultured the eyes of the calves up here at the field station, we found some bacteria that were not the classic bacteria that we had associated with pinkeye. The classic bacteria we associate with pinkeye is something called Moraxella bovis. And when we looked at a bunch of calves up here, we found that most of them did not have Moraxella bovis. They had another bacteria that was not Moraxella bovis. And for the next 4 to 5 years, I spent my time trying to figure out what that bug was. And in last year, we published the results of 5 years of work, and we demonstrated that it's not Moraxella bovis, it's a different species of Moraxella. It's probably been around for forever, for a long time, but we had not recognized it as such. And we gave it a name, Moraxella bovaculi, reflecting the name. It came from a cow and from a cow's eye. Right now, there are no commercially prepared vaccines against this organism. And so the question is what to do for vaccination. In the herd up here at the field station, what we find every year is that we have both Moraxella bovis and Moraxella bovaculi. In some eyes, we will culture one bug, will grow M. bovis, and some eyes will grow M. bovaculi, and some eyes will grow both. And So the real question then is, what do you do for vaccination? We think that this bug is important in causing pink eye. The jury is still out on that. I did a small trial last fall where we infected some dairy calves with this new bacteria, but I could not actually demonstrate full-blown pink eye in those calves. So the debate is still out. We have to repeat the trial. But in the meantime, we do believe it's important. It has the same related toxin genes that M. bovis does, so probably it is an important component to pink eye. But the best recommendations that we have right now would be to, if you are going to vaccinate, to start by using one of the commercially available products for pink eye. And then if it is not working and you're having failures, then consider having an autogenous bacterin made for the organism that is present in the herd, depending on which Moraxella it is. You can work with your veterinarian to get eye swabs. The veterinarian can send those swabs to a microbiology lab. They can determine what is actually present. And then there are vaccine manufacturers who will offer that service if their commercially available vaccine is not working. And at least one I know of that does that is the company that makes MaxiGuard pink eye. They claim that if that's not working, they will send you a kit, or they'll send your veterinarian a kit so that you can they can culture the eyes, and then they'll provide a vaccine based on what they are growing in the herd. How many of you still use these NFC puffers? A few of you. It's still popular. The thing is, these NFC puffers, it's kind of a catch-22 because they sell them as treatment for pink eye, but if you read the small print, it says federal law prohibits the use of this product in food-producing animals. The chemical that's in these is nitrofurazone. That is expressly illegal to use in food animals. And so it's not recommended that you use that. However, if you go to the Jeffers Supply, you'll find it, and that's where I found this picture on their website. So these are not legal to use, so keep that in mind when you're deciding what how you're gonna treat pink eye. This coming summer, next month I'll be starting a vaccine trial looking at a combination vaccine of both the M. bovis and the M. bovaculi. It's a vaccine that we are having made by an outside company. In doing that, I'm hoping that if it works, that company would be more likely to want to market it and potentially make something like that available, because despite doing this research and finding vaccines that we think work, it's very hard to actually get a company to put forth money to then want to market it. The University of California has spent $120,000 getting the various bacteria that I talked about, the ones we discovered, getting them patented, getting the DNA sequences patented. But after 5 to 8 years of doing that and investing a lot of money, no companies have come forward and said we want to make a vaccine based on that. So we're still trying, and I'm sure it's frustrating for you all, but thinking, well, we're not doing anything to make better vaccines, but we actually are. We're certainly trying. So I guess we'll hold questions for the end.